Ivan, welcome to Colombo. My name is Quincy Saul. I'm a co-founder of Eco-Socialist Horizons internationally and locally here in Sri Lanka. I'm working with the Sarvodaya Institute of Higher Learning. And I'm very honored today to be here with Dr. Kamal Gamampilla, who is, I think, one of the foremost people to listen to in Sri Lanka today about a very grave subject matter, which we're here to learn about. Doctor, a lot of people refer to this grave subject matter as kidney crisis, the kidney crisis, chronic kidney disease. But reading your work and reading the work of others, I've realized that this might not be the best way to talk about it, because what we're dealing with right now in Sri Lanka seems to be really a catastrophic health crisis, which is not just about kidney disease, but it's about cancers, it's about blood diseases, low birth weights, cardiac conditions, stunting of children at birth. And moreover, this is happening in the heartland of what we consider, what we take so much pride in Sri Lanka, the Polonnaruwa, Anuradhapura, the ancient Sinhala Buddhist kingdoms. This is the places that are suffering the most from this massive health crisis. The president, Sri Lankan government has said 400,000 patients affected. Dr. Gamampilla has said maybe it's closer to 800,000. Others say it's closer to 3 million people suffering from these crises. Again, it's not just kidney crisis. One person has said Sri Lanka has the highest rate of oral cancers in the world. Doctor, please tell us what's going on here. When did this start?
Right. It was in 1992. A new kidney disease was identified in Anuradhapura in 1992 by a doctor there, and which normally kidney disease is associated with high blood pressure or diabetes. Here, this was happening in the absence of those two. There are other rare conditions, but let's not focus on that now. But unique kidney disease was identified in 1992, but up to now, we seem to say, or Sri Lanka says, that they don't know the cause of it. I don't think that's entirely correct, because those who initially identified the condition went on to show that this is probably linked with heavy metals. Leading doctors such as Dr. Tilaka Abhisekara and the doctor who found this out, Dr. Nimi Athukurala, and they did further studies and they indicated that this was associated with heavy metals. And somehow, following those studies, we had a major study conducted by the Sri Lankan Health Department with the technical assistance from the WHO. And that too indicated, or claimed, I might say, that there is sufficient heavy metals, cadmium and arsenic, for example, in our diet to cause kidney disease in some of these people. And of course, at the time, the emphasis was on cadmium as the agent identified for chronic kidney disease. But today we know that lead is a kidney disease causing agent too. And in the WHO study, amount of lead exposure, the amount of lead found in the urine of study groups, there were 3 study groups, kidney patients as such, a control group within the area, another group from a different part where they thought there was no kidney disease. And in all 3 cases, the lead levels are much higher, in some cases 5 or 6 times as much higher than the cadmium. The thing is, if we could identify by cadmium as only a certain number as it were in the WHO study, now if you were to consider the same study data, we should be able to completely identify heavy metals as the cause of this disease now. That is a combination of cadmium and lead. Unfortunately, we haven't as yet conducted what's called a DIAS study, which the WHO recommended. And my call on the government and the agencies is to begin to address this crisis as soon as possible, because as you know now, it is not only kidney disease we have. We know that the babies are born with undersized kidneys, and their birth weights are low in those areas. And there are the blood diseases. There are almost unique heart conditions now. And some of our nephrologists, scientists have worked, people from England and Scotland as well, and they have found this unique cardiac condition. So equally, oral cancer. that is prevalent in Anuradhapura, Polonnaruwa, Kurunegala, according to the president of the International Society of Oral Pathology, and that was in 2016. And he said they are in Anuradhapura, Polonnaruwa and Kurunegala. They are places where we had a kidney disease. And also the youngest group is only 6 months old. And that, for that to happen, the most likely cause is their mother's milk is toxic. Okay. We know from elsewhere in the world that the mother's milk could be toxic. And it's quite clear now, also with our understanding of the condition now and with the data we have, at least there are 3 good publications to show that the heavy metals are the cause of this disease now. And so one might think, we cannot say exactly what is causing the oral cancers, but it is associated with this toxic exposure.
Okay. Thank you, sir. We're sitting here with Dr. Kamal Gamampila, who's been researching this for close to a decade now, about 7 years. But before that, he has various degrees in the biomedical sciences, so medical engineering, medical physics, and in many different fields which relate to this. One of the reasons I think we can trust him on this subject is he's not beholden to any particular research agency or any political party. He's been researching this independently for many years now in a lot of detail. Something you said in your communication with me was that we are currently, you were just speaking about the people are suffering from 6 months old up until their old age. And that again, this is happening in the very heartland of the culture of which this country is so proud. You said that we are really violating all human norms here, and that what we need to do is that we haven't opened our minds properly.
Absolutely.
We have not opened our minds properly about this massive health crisis happening in the heartland of Sri Lanka. Tell us a little bit about yourself. How did you open your mind properly? And why are you passionate about this? Why are you doing what you're doing?
Right. I normally live in UK, and I've been a biomedical scientist, biophysicist as such, and all my life I worked in the health service. And I got a Master of Philosophy in biophysics and physics from Brunel University, and a PhD in physiology from the Faculty of Medicine, Imperial College. And when I came on holiday in 2013, I happened to attend the meeting in Colombo following the publication of the WHO study. At the end of the seminar, they said, why is it only in Rajarata, this area we are talking about, when we use the same fertilizer everywhere and need the same food everywhere in the country? Unfortunately, that question is being asked even today. Hence, following that meeting, I got involved initially out of interest as such. But here I am still involved in the subject simply because no one seems to have solved this issue, and also it is partly not because that they haven't the knowledge. It is quite clear to me now they are in denial as to this cause. Most unfortunately, the crisis has come to a point now in places such as Madavachi in the heart of Anuradhapura district. Since 2015, it has been known to the Health Ministry of Sri Lanka that about 25% of the rural villages have the majority as kidney patients, and some places this goes up to 60%, 70%. And it has to be quite clear to anyone at all. One doesn't have to be a scientist to realize that these villages are not going to recover. They are annihilated villages.
This is the industry term that I learned last night. If it doesn't send shivers down your spine, then check your spine. Annihilated communities. These are communities where over 50, sometimes up to 75% of the people are going to pass away from some form of
kidney disease. Kidney disease, yeah.
And again, this is in the heartland of Sinhala Buddhist civilization.
Absolutely. And also I must add something here, Quincy, that we also got this now. Well, it wasn't acknowledged earlier, but it is acknowledged now in southeastern part of the country too. And the common factor in these two, and also the factor that distinguishes kidney areas from rest of the country, is that these two places use irrigation water from another region for rice cultivation.
So now we're getting at some of the causes here. He's spent more than half a decade researching this. There are various causes. It includes heavy metals, cadmium and lead. It includes the water runoff from the hill country, and it includes fertilizers and herbicides and pesticides. The combination of all of these effects are what is generating this. So it's, I think, if to say it in a word, maybe if you'd correct me if I'm wrong, industrial agriculture.
Yes, indeed. Yeah, yeah. And in the hill countries, we've got our tea plantations, as well as, of course, the vegetable plantations. They all use fertilizer, weedicides, and pesticides. But when you look at the ratio of vegetable plantations to tea plantations, it's something like 3:1. Okay, so the major contributor, I believe, is the tea plantation.
We've moved inside a bit because it was raining, but we're here to continue the conversation about one of the largest crises happening not only in Sri Lanka today, but in the region. Sri Lanka is really a case study in the world, I've been learning from Dr. Kamampila, that the whole world really, and this interests me as an internationalist, has something to learn from what's happening right now in Sri Lanka, which is very grave. When you see the numbers and you say 400,000, let's say, is the Sri Lankan government's estimate of the number of people affected by this, then you say, okay, country of 20 million, maybe that's not a large number. But then when you look at the concentration of these numbers, you're seeing that certain communities are being annihilated. That's the word they use in literature, annihilated communities. There are places where 50 to 75% of the people in the village beginning at the age of 6 months are diagnosed with these chronic illnesses from which they will not recover. We've known about this for some time now. You have been sounding the alarm for many years now,
yes.
But somehow the message is not getting through. So I'd like to pick up from that. We've identified some of the causes. We're going to attach some links. You can look into heavy metals, cadmium, lead, fertilizer, herbicide, and water contamination, soil contamination. But why are we not doing something about it? In reading some of your work, I think I've been able to think of 4 agencies in particular. 1, the political system. 2, the agribusiness system. 3, the scientific system itself of research. And then 4th, international agencies.
Absolutely. And if we look at the political system as it were to begin with, it's a local problem, and the politicians should know by now what's happened in Medavacha, where such large proportions of the local populations are kidney patients or identified as kidney patients. And if politicians are unable to identify that, and that in itself is a political problem. It doesn't matter who's in power, who's running the country, but the rulers who cannot understand and appreciate the issue of that nature and not do anything about it even if they knew, which is the case now. Hence, it is a political issue. And in Sri Lanka, all the political parties believe that it is to do with something they might have done. With good intention and with a good heart, they have done very many things. But what's happened now is things have gone wrong, as it were. I don't think it is their fault at all. I wouldn't blame any party or anybody for what's happened in the past, but for not addressing it. Now I cannot not blame. I cannot stay without blaming as such or pointing the finger at these people. And it is an inevitable truth that you got to say things are not done properly, things are not managed by in Sri Lanka by all the political parties.
So we have the political parties. You're saying maybe none of them are guilty, but all of them are responsible.
Absolutely, absolutely. I think if I were to trace back as to how this began, as it were, and I think I mentioned that earlier, in 1992, it was identified in Anuradhapura that there was a new type of kidney disease. Now, my studies show that this kidney disease is limited to places where we get hill country water for rice cultivation. Anuradhapura, Polonnaruwa, which I might call the wider north central region as such, and also in the southeastern region. It's a different set of rivers. that they also get the water from the same hill country, but different parts of the hill country too. And some I might say are common, but these are the only places we got the kidney disease. In the western region, for example, we don't have kidney disease. Jaffna, we don't have kidney disease. And on the eastern coast, where what's called the Ampara district, much of it don't have kidney disease. Because, for example, in Ampara, they use water from the, one of our largest reservoirs in that area that collects water from non-agricultural lands, as it were, from the local jungles. And Jaffna, we don't supply hill country water. Southern region, we use rainwater for rice cultivation. And wherever we have the rainwater for rice cultivation, we don't have the kidney disease. Wherever we have use of hill country water for rice cultivation, we got the disease in those places. I might say at the moment, it is quite possible this might spread to other parts of the country, because about 65% of our rice comes from the CKDU areas. Whatever people who purchase rice in supermarkets, for example, there's a good chance they would be exposed, not in the same manner as the paddy farmers.
Right.
Paddy farmers are exposed day in and day out,
right,
because they eat the same food and they are rice virtually every day, so to say.
Right.
Or I shan't say every day, they certainly do every day, perhaps every meal. Whereas in urban settings, they would eat other things, and the rice may come from various different places. So 1 week their rice may be toxic, the next week may not. It is so they are randomly exposed as such, and in the average you get an average exposure over a long period. So the different type of exposure, like in alcohol consumption.
Right.
Those who consume large quantities regularly, they fall ill, and we all know that. Others may fall ill at different time, or some may not at all, those who consume socially on occasion. That exact thing is happening in this situation too. And that's a political thing locally. And locally too, it appears fertilizer industry and weedicide and pesticide industry, they are mostly, more than manufacturers in Sri Lanka, they are importers and suppliers, and they are covering up. It's quite clear they are covering up, because in the newspapers one would say, learned people have been writing in the newspaper criticizing the farmers for overuse of these agents. But if that is the case, why don't we have this problem in other parts of the country? You know, because fertilizer and the other agents are used everywhere in the country. So it is not the fault of the farm, but very many scientists, people from the agriculture industry, from the fertilizer industry, have been writing in the newspapers, for example, blaming the farmers. So this is partly academic, because of these people are not non-educated people, they are highly educated people. Not only that, now when it comes to academia, most unfortunately our academia has been destroyed now, because there are bogus publications.
Bogus publications?
Bogus publications. And I can show you some of those things, and perhaps you might be able to show them, where when they did a rice study, how 27% of the samples were taken from a non-CKDU area, to show that, because it falls within the dry zone, to show that the dry zone has high kidney patients but low rice toxicity in heavy metals, because they managed to show that the rice from other areas, the wet zone, has more levels of cadmium and lead, for example, than from the dry zone. So they were trying to say rice, cadmium or the heavy metals are not the cause of kidney disease, and that is not a thing that we should try to disprove or prove whether cadmium or lead causes kidney disease. These are almost accepted fact by the WHO, the UN, the US, the lot. And those who try to say these things are not even medical doctors or from the medical profession. They are geologists and water engineers. And in fact, 2 studies were done on rice by geologists and water engineers. And they both claim that the rice is safe. They said so because they did not know how to interpret the safe limits.
Right. So what we're hearing from the doctor here is that in terms of, again, he's saying he's not pointing the finger at any particular individual. He's saying nobody's guilty, we're all responsible. It's the political system for not solving this problem, even though the writing's been on the wall since 1992. He's saying that it's the It's the agribusiness lobbies who are bringing in the fertilizer, herbicides on so much. But it's also the scientific establishment itself, which continues to generate confusion. And the model that comes to my mind is tobacco. How for decades, industry paid millions of dollars to generate doubt. Perhaps smoking doesn't cause lung cancer. And it worked. And now we find out they're doing the same thing with climate change on an international scale. The big oil companies spend millions of dollars saying maybe carbon emissions don't cause climate change. And so now we have the same thing. We have millions of dollars of studies being promoted to show perhaps it's not heavy metals, perhaps it's not glyphosate, Roundup fertilizer, generating confusion so that we don't come to conclusions about this.
Absolutely. In Sri Lanka, top scientists from Sri Lanka itself, although they live overseas now, and who claim that glyphosate does not cause kidney disease or these issues in Sri Lanka, as well as say that our soil is toxic by nature. This is far from the truth as it were. It couldn't be further from the truth as it were.
It's not bad enough to blame the farmers, blame the victims. We're going to blame the soil itself, which is heritage to one of the most greatest, amazing hydrological civilizations in the world in history. They're blaming this now.
Absolutely. And another thing is, now a group of scientists try to say fluoride is the cause of this kidney disease.
Another one.
Yeah. And they said it is because of geological fluoride. But the thing is, fertilizer has 1,000 times more fluoride than the heavy metals. And it is coming from hill country again. That is why over a long period of time, we've been having fluoride-related dental fluorosis, for example, in these areas. It is not the geological water or the water they've been drinking per se, but they've been getting additional dose in the drinking water coming from hill country acid. So the thing is, no one seems to be wanting to say the fertilizer industry in this instance, to say the fluoride is coming from fertilizer. So they are all covering up.
Everybody's covering up, and that's why we haven't been hearing more about this, I presume. Even though, again, communities are being annihilated, and we're not seeing solutions. Sir, I think one thing, I was doing research about this, and I realized that the chronic kidney disease is not limited to Sri Lanka. This is very much a global problem. The other places where there have been large studies, almost in the same latitude as Sri Lanka, are Nicaragua and El Salvador. People are calling it a silent massacre. The numbers of people that are dying by the tens of thousands, and those are El Salvador and Nicaragua are only named because they're doing studies there. But we're talking about all of Central America. It tends to correlate with poor communities. It tends to correlate with plantation agriculture. What does the world? It's a global crisis. But it's the epicenter in a way seems to be Sri Lanka. What can the world learn from Sri Lanka?
Oh, I think the world has a lot to learn from Sri Lanka, and they all should come here to learn from our unfortunate experience, as it were. But the thing is, already we know that rice, for example, has sufficient quantities of lead and cadmium, more lead than cadmium, to cause this chronic kidney disease several times over, as it were, in the farming communities.
And the source of this lead and cadmium?
Fertilizer.
Fertilizer.
Absolutely. There's no doubt whatsoever about that. And the reason why it is in these places is, as I said, from the hill country, they get an additional dose. What's happening is, in rice cultivation, you need about, well, what we might call the rice water footprint is about 3,000 to 5,000 liters per kilogram.
Everybody catch that, listeners. 3,000 to 5,000 liters of water are going to be filtered through that 1 kilogram of rice that you're eating.
Indeed, to harvest a kilogram of rice, you need that much of water. All this, the water contains tiny amounts of these toxins, which cannot cause kidney disease by drinking it, because the dosage is low. But however, if you use it for rice growing, rice gets an additional dose, and through what's called process called biomagnification. So sometimes it has so happened now, what the chemical dosage to the rice plant from the irrigation water is greater than the direct application of fertilizer itself. So they got two sources of toxins in the rice cultivation, one from water, one from the direct application of fertilizer. But there's a third one. Rice plant takes up only about 1% of what's available. what happens to the rest? Rest remains in the soil. It might get washed away when the rain comes, for example, a little bit to the patch, it goes to the next paddy field, and the next paddy field, following the next rain maybe. Now the soil, that takes to grow half a kilogram of rice, which is about 2.5 square yards, and a root depth of about 14 inches, contains 10 to 50,000 times of arsenic, cadmium or lead than comes out in the rice grain. So in that scenario, one doesn't have to be a specialist in this area to say this doesn't sound right, and that is exactly what's happening. Now we need to clean the soil, we need to clean the water, and it's a massive operation which might take 20-25 years. No quick fixes, I'm afraid.
And that's what I'd like to come in with our final question here for this session. Obviously, we can follow up with many more questions. In terms of what we should do about it, this is not something we can show up in a day to fix. No. There's no Band-Aid solution to this issue. This we identified the problem in 1992, which means it began before then. No, maybe beginning of Green Revolution. I don't know, we haven't gone into that, but there's a long history. It took generations for it to get this bad, and it will probably take generations to get out of it. You said in one of your other interviews an example that we can learn from. In Japan, there was an industrial accident which poisoned an entire area with heavy metals, and the Japanese government took massive structural changes in order to, and you were saying that this is on the scale of what's needed in Sri Lanka.
Absolutely. If anything, it's far more greater scale.
So we need to go beyond that.
Absolutely.
Yeah. Say more about,
thing is, as Quincy was saying, the world has a lot to learn from our tragic experience, and they certainly should come here. But unfortunately, the way I see it now, most of the people who might come here are coming with the belief that this is climate change. This is nothing to do with the climate change, I might add, because the paddy farmers work only about 40 days a year in the paddy field, whereas the building site workers, road builders, for example, work maybe 250 days a year under worse conditions. And also there are publications within Sri Lanka by our nephrologists, for example, to show that it is not the climate change that is causing this problem in Sri Lanka. And those who come to help us need to come with a very open mind, not only an open mind, to begin to address this issue from the starting point that what the agents that are being identified already for this condition. Unfortunate thing is, as we know now, it's not only kidney disease, other diseases are there too. So we need to look at spectrum of diseases. But at least if we begin to address the kidney disease now, thing is, it might automatically resolve all the other problems too. One important thing I need to say here again. Sri Lanka, we believe that, some of us believe that micronutrient deficiency is a problem in the rural community. That could be so. But in my analysis of the WHO data itself, shows that there is micronutrient excretion when people are exposed to these toxins, long before they could be identified as kidney patients. So the problem might be that the diet itself is causing the micronutrient deficiency, and that is what making the young children waste or stunting. Because the food, the very food they eat, got toxins to make the food not deliver the full capacity or full quantum of goodness as it were to the body, meaning what is called calorie intake. Some of the calorie intake is being wasted because of toxic exposure.
Right. I'd like to clarify the question a bit. If you live in one of these areas, it seems to me that there is no individual market-based solution to this, that you can't grow some different food. It's your soil is toxic.
Absolutely.
So whatever you grow in it will have an increased level of toxicity from the groundwater and the soil from generations. So if we live in this area, we require state action.
Absolutely.
at a massive scale. In Japan, they brought in new soil,
Yeah, absolutely.
replaced the whole soil, took some land out of cultivation, brought in new food, gave people new livelihoods.
Yes, absolutely.
This is what needs to happen in the heartland. Otherwise, when we bring in tourists to see the ruins in Polonnaruwa and Anuradhapura, these will be dead communities.
Absolutely, absolutely. The thing is that we need emergency action now. In my belief, I believe that Sri Lanka should identify the problem first,
Okay.
and then say ask for help from the international community and the UN. I believe we need to make the children and mothers of these communities ward of court of the UN. Then they will be responsible for them, because Sri Lanka can't solve this. It's a fact.
How many, what would you estimate the budget would be to solve something like this?
I think it might take about 5 years of clean food to get rid of the toxicity in these people, because they got what's called a biological burden now. We need to reduce that. Thereafter, we need to maintain a safe diet, and for that purpose, we need to import rice maybe, or begin to grow rice in places like Ampara maybe, where we use
not
rainwater
toxic.
and open up new areas. That could be up to about 500,000 acres. It's a huge operation. But I think about 5-year grace period is required to get things in order. But what is most urgent is immediately action now, regardless of any research. We got enough research
Yeah.
to show what is going on.
What's going on, right?
Act immediately and get the help from the World Food Program. For 5 years maybe, aid with food. And also the FAO to help us with new crop varieties. We can grow other different things in these fields. Everything need not be edible as such.
Right.
There is a problem there.
Right.
But if we use edible things, such as sunflower,
Sure.
I am told by chemical engineers that they may be able to take the toxin
Extract
out
this,
as
yeah,
it were.
yeah.
So we need to look at these things very urgently, so that the poor people retain their land value, retain their livelihood, and still we are able to address it. And it is not a national problem that we can solve. No, it is a global problem. No country could solve the issue like this without the global help. And we need to ask the WHO and the UN for their assistance. And we need, Sri Lanka has to truthfully declare what's wrong with, what is what as it were. That is not happening at the moment.
Thank you, sir. So we have a catastrophic health crisis. It's a global problem, requires a global solution. But everyone here in Sri Lanka has an opportunity to lead the world in implementing that solution.
Yeah, absolutely.
I'd like to thank the doctor for joining us. We're going to link to many more articles and details if you want to go more into depth on this subject. He is retired, but came out of retirement to work, he told me, harder than he's ever worked in his life investigating this subject. Nothing less seems to be at stake to me than the heart and soul of this country. And I hope that we can all do something in our lives to make a difference.
Absolutely.
Thank you.
Thank you.
Thank you.
Okay, yeah.